Okay, hello once again. It's the fourth case, and this is a very special case. So I care a lot of this case because it's a unique combination between this ureteroscope, it's Hawk. It's an ureteroscope made in November 2025. And this ureteroscope has two great advantages. The first one is, he can measure the pressure and IRP, of course, IRP, and also he can measure the temperature. This is quite good. It's impressive because if you look to the presentations, there are two main possibilities to realize the control of the pressure, intrarenal pressure. Is ureteroscopic, like this. The sensor is here, and is on access sheet, like this. Access sheet being elephant 4, and with Tidor. With Tidor is the sensor is into the access sheet. So there are two main possibilities to know the pressure and the temperature. For us, for our safety reasons, it's imperative to know nowadays, in 2026, of course, we discussed about the new technologies from 2025, but we must know the intrarenal pressure and the temperature. This is the safety for the patient. Not only the efficiency is clear, but the safety is very important. So this case will be now presented, and we'll use together, once again, this kind of ureteroscope made in November 2025, and this kind of access sheet that is, I already described, is elephant 4 and Tidor. So please, the fourth case. Okay, so regarding this scope, Hawk, in EU guidance, and also in publications from the team of EU Endoscopic, is written in some months ago that this Hawk ureteroscope is really one of the most important ureteroscope concerning the measurement of temperature and of course of intrarenal pressure. And this is the scope, is a new scope, and this is the Tidor. And if you look here, look to the screen, it's temperature 11 degree, and of course pressure is not yet working. But this is really very important. Also, Tidor and this elephant 4 in the same time, its destination is for control of intrarenal pressure, and also for irrigation, and also for suction. This is really very efficient. So that's why I'm so happy and I'm pleased to the Chinese preference from YiGaoMed. They are here together with us, and we introduce this new technology in Romania and of course in Europe, because it's the first time that they are present here. So let's see look to the screen. Okay, this is for Hope, and look to the screen. This is for Tidor 4, with the characteristics, the data on the screen. So let's start our ureteroscopy. Okay. Good. They calibrate now. Now it's calibrated. Yes. Now they calibrate the system. Okay. The system is calibrated, and now we enter with this ureteroscope. You can see very well. Yes. Yes. Just this. Look to the pressure. It's 20. It's 15, 14. Look, this is the pressure. IRP. So it's very good. The data. Look, it's safety. And look here to Hawk. It's look to the pressure and the temperature. So let's go. Let's enter into the kidney.